Welcome back. As the pandemic continues, the demand for travel nurses is up. Our next guest is no stranger to our program. Nurse Narelia Oliveras-Arzuaga formerly worked as a nurse here in the Bronx, and she's now a traveling nurse. Welcome, Nurse Nare. It's always a pleasure having you here. Thank you for joining us.
Thanks so much, Sonyi. It's great to be with you ladies again.
Of course. So first, it says it in the name, I think, but I just want to clarify what a traveling nurse is, and how's your position has changed as a nurse since we last spoke.
Well, I'm actually still, for the rest of the month, I will be finishing up at Lincoln. But starting February, yes, I will be taking on a travel assignment. So what that means is it's applicable actually to anyone in the healthcare field. You don't need to be a nurse to be a travel healthcare worker. You can be a nurse's aide. You can be a respiratory therapist. You can be a doctor, a nurse practitioner. Anyone really is eligible to travel. What it means is basically you get quickly onboarded. So you get an assignment. Hospitals are looking. Basically, it's because they have a demand. So they usually hire a contract travel agency to get somebody for them. So they don't have to go through the legwork of doing the hiring themselves and going through their own HR. And what happens is once you're selected for an assignment, you get onboarded pretty quickly, meaning that all the hiring happens within 1 to 2 weeks maximum time. And then after that, you're pretty much expected to jump right in. So there isn't a lot of training. You're expected to know your job, be experienced in the field already. Traveling is something that is not for new graduates of any type in any capacity in the healthcare field, because it wouldn't be fair to them, and it's not fair to the hospital or healthcare agency, which is needing you to come on board and jump in quickly, and so they don't really have the time to properly orient you. So it's something that, like I said, happens very quickly. Great opportunity, lots of money that can be made, but there's definitely, you lose on building that community, building that relationship with the staff, and you, depending on what agency, you may potentially lose out on some benefits.
Well, we'll miss you here in the Bronx. I know that you're going to be traveling outside of the Bronx now in order to work. So, of course, we'll miss you. And a lot of things have changed for you. Not only are you getting a new position as a traveling nurse, but we've heard also that you had COVID-19. Can you share some of your experience? How are you feeling today? We're glad to see you looking better, feeling better, but just share a little bit of your experience with contracting coronavirus during this time.
Yeah. So, I just want to start by saying it's super difficult to be sick. And it's a really humbling experience to be on the opposite end of that, because us nurses, we're horrible patients. And I think sometimes because we take care of people, we forget what it's like to be the one who needs to be taken care of. And so it was difficult, obviously. I am super grateful that I had a really mild case of COVID. I just basically had lots of body aches, lots of stomach upset, lack of appetite, but I had no respiratory symptoms, thankfully. I didn't experience what most people experience with being short of breath, with having a low oxygen saturation. I did not have to go to the hospital. I was able to quarantine at home and then quarantine using the New York City hospital isolation program.
Mm-hmm. I wanted to ask you about that. As you mentioned, New York City offers the isolation rooms to those who test positive for coronavirus. Can you tell us more about this program and who qualifies for it? How did you sign up for it?
Yeah. So as soon as I informed some of my coworkers, they quickly were like, "Oh, this is what you should do. This program's out there." I did know the program was out there, but I'm fortunate enough to have such excellent coworkers that they sent me the information directly and said, "Look, this is the number that you need to call. This is what you need to do." So I did. I did not want to get loved ones sick.
Yeah.
So I called. It was actually very straightforward. There is a 212 number that you call. You do have to wait a while sometimes. I think I waited about half an hour before I was able to speak to someone, but I spoke to a nurse who was able to give me all the information that I needed. The only requirement is that you are a New York City resident, that you have an address within the 5 boroughs, and they really don't ask many questions after that. It did take a couple of days for them to set me up. I did also call late on a Sunday night. So maybe it had to do with the timing of the situation. But I was able to get into the hotel by Tuesday and stay there for the rest of that week. I finished my 10 days of isolation as required because I was symptomatic.
Okay. And Nurse Nada, do you have that number to share with our viewers? In case somebody's listening now and they're seeking to find out more about the program.
Yes, I have the number. It's 1-844
Mhm.
692 4692. And anyone from New York City can call between the hours of 9 a.m. and 9 p.m., 7 days of the week.
Perfect. Thank you. And Nurse Nada, just to clarify, are there any like out of pocket costs that somebody would have to dish out in order to participate in this program, or is it all free and funded by the city?
No, this program is 100% free and funded by the city. And that's something that they make very clear to you once you call. I think that really helps to alleviate concerns because the people that are calling are already sick or their loved ones are sick. And these are already confusing and anxiety provoking times that we're in. So it's great that they are no cost. They actually will coordinate transportation to and from the hotel if needed. There's actually 3 hotels right now that are still taking COVID-19 patients. 2 of them, I believe, are in Manhattan. The one I stayed in was in Tribeca, the Sheraton Hotel in Tribeca on Canal Street. And there is also one by LaGuardia Airport. It's actually the LaGuardia Plaza Hotel.
Gotcha. Thank you for sharing. I want to shift gears here and I'd like to explore COVID-19 vaccines. Recently, we've seen some pretty scary headlines, such as the Norway, story about reviewing deaths of frail and elderly patients vaccinated against COVID-19. Another headline was about California shelving a batch of Moderna vaccines over allergy concerns. The only headlines here so far in New York, however, are that the city might run out of vaccines soon. From a nurse's perspective, can you help us break down what happened in each of these individual cases and if people should be worried here in New York City about the vaccine?
Absolutely. So what happened in Norway was really unfortunate. It seems like the Norwegian government, what they did was focus on the trying to get the elderly and those in nursing home or group homes the first doses of vaccines. So apparently, after receiving a dose of Pfizer, the Pfizer biotech vaccine, 23 residents of a nursing home in Norway did pass away. The reasons why the cause of death is actually still being investigated by the Norwegian authorities. What I did read when I did some research on this was that majority of the residents who did receive the vaccine already had chronic health conditions and were already in either terminally ill or their health was basically failing. So it's truly hard to pinpoint without, I guess, an autopsy being done on these 23 individuals the exact reason for cause of death. Is it alarming? Yes, it's definitely very alarming, but this is not the typical, the majority of the population. Majority of the population in most countries is young or middle-aged and does not suffer from chronic health conditions, and of course is definitely not terminally ill. So this isn't a good study population to try to basically to try to see if the vaccine is truly not effective or it's dangerous. This is not the right population to look at it, and we should not see it through this lens, because if we do, then we're obviously just going to be scared and say, hey, we're not going to take the Pfizer vaccine.
And as we understand, the first phase of recipients, not only here in America, but I guess in Norway as well, they implemented the same phases. The elderly and people with underlying conditions were one of the first to get these vaccinations. So as the community starts getting access to it, younger folks are able to qualify for it. Then they can figure out, I guess, how that works, how the vaccine works a little better. Is that what we're saying? Also, it depends on the research.
Yeah, definitely depends on the research. They've been working on this vaccine for over a year now. I think that's something that's pretty common knowledge. And again, there are definitely concerns, and there are concerns that are valid, absolutely. And anyone who is choosing not to take the vaccine, I personally would not blame them. It is a very personal decision. It's the same thing like when you're taking a flu vaccine. is the flu a national, worldwide pandemic? No, it's not. So it's different. But the choice of you taking the vaccine or not is definitely one that's very personal. And of course, just like anything, all vaccines have some side effects.
Mm-hmm.
There's definitely been lots of talk in the nursing community, especially on social media, about nurses sharing their individual experiences. The overwhelming majority of nurses that have gotten the vaccine that I know of have had very minimal symptoms. There's been arm soreness at the injection site. There have been some fevers and some body aches. However, they've been very, very minimal. I think the overwhelming feeling overall in amongst healthcare workers is that both Moderna and Pfizer's vaccines are effective and safe.
Got it. Thank you, Nurse Nare, for sharing. The other headline that I wanted to discuss was about the California shelves batch of Moderna vaccines. Like they threw away a batch of Moderna vaccines over allergy concerns, just to put it blatantly. Can you tell us more about this story as well and what happened there?
Sure. So what happened was they opened up the stadium in San Diego, where the San Diego Padres, their baseball team, plays. I think it's called Petco Field, and they actually converted that into a mass vaccination site. So what happened was about 10 people, after receiving the injection at the same site, so I believe, I'm not sure which arm it was, but at the same site, they developed severe allergic reactions. So what the San Diego Health Department decided to do was to dispose of that specific batch. So vaccines, when they're created, they have a lot number. And so they can be traced to exactly where they were created. Of course, depending on who made them as well, which company created the vaccine. But basically, it can be traced down. So what they do is, if there is a concern about the vaccine being safe, that batch being safe, they'll get rid of the entire batch.
Okay.
So that's what they did. So they threw out the remaining doses that were together with the same lot number.
Got it.
And out of overwhelming concern and caution, because they didn't want this to continue if it was a problem with that batch. Like everything, there could always be a bad batch of anything that's made in a factory. There is nothing that is 100% like foolproof. Quality assurance is done, but I guess that was a bad batch because those people experienced that reaction. Again, it was less than 10 people. And the health department got involved right away, did the absolute right thing. I think it's noteworthy to say that there were 200 other sites in California. California has received over 1 million doses of the Moderna vaccine. California is obviously a huge state, and the COVID rates in California are through the roof, unfortunately. I think we've heard a lot about LA and the issues that they're having with actually physically maintaining the deceased bodies. So we know how bad it is in California. So California has received over 1 million doses just of Moderna vaccine. I think it's worthy to say that this vaccine was also, Moderna has been distributed to over 200 injection sites in California, and no other sites are reporting issues. So I think that can boost confidence a little bit for people in California.
Thank you so much, Nurse Nare, for helping us break that down. Because, as you know, when we're on social media looking at these headlines, we immediately get, scared. There are a lot of new developments coming out, a lot of news coming out regarding the COVID vaccine. So we want to make sure that we keep our bronchites informed. So thank you always. Before we go, can you just leave us with a message to the community on keeping safe during these times?
Absolutely. I think that we obviously need to continue doing what we're doing here in New York. I think we've done a pretty excellent job. I know rates have gone up everywhere, but for being such a huge city, I think we've done a fantastic job. I want to say thank you to all the New Yorkers who are doing their part. I know so many of them are working from home, teaching their children from home. It's been so difficult, but I think we're finally seeing the light at the end of the tunnel. And that's an amazing thing to say today in light of the inauguration as well. We just have to continue to do what we've been doing. Continue to wash our hands, continue to wear our mask 100% of the time. Don't let up at all. And of course, if anyone is sick, CDC guidelines say if you test positive and you don't have symptoms, you should isolate 10 days from when you tested positive. If you test positive and do have symptoms, you should isolate 10 days from when your symptoms began. It's also safe to get, it is safe and recommended to get another COVID test after the 10-day period and make sure you are negative. That is what I did. Before I stopped wearing my mask, even inside my home, I made sure that I was negative. I think that's really, really important. If people have issues getting tested, please reach out to the city. Also, I want to give a shout out to where I went to go get seen, the Institute for Family Health on Walton Avenue, 1894 Walton Avenue. They do PCR COVID testing, so results take 2 days, but they have a whole area dedicated just to do COVID testing. So definitely patients from the Bronx can reach out there if they need to.
Thank you so much, Nurse Nare, for joining us once again. And thank you for your work, your tireless efforts during this pandemic. Thank you.
You're more than welcome, Sonyi. Thank you guys for having me again. Please take care and stay safe.
Yes, you as well. Nurse Narelia Oliveras-Arzuaga will be joining us occasionally here on Open BXRx. So, expect to get updates from her more often. We'll be right back with Open BXRx.